Health and community services in the West obviously are marked by needing to care for a really diverse community. And that could be from a cultural perspective, but also a variety of socioeconomic backgrounds and really anything you call diversity in the broadest sense of the terms.
People from diverse backgrounds are experiencing a lot of obstacles. That is a big issue here that government organizations and institutions such as HealthWest are trying to address.
There's a lot going on in the west of Melbourne. The West has always had a kind of strong grassroots gathering of people from different areas, and not always those who are seen as the experts, but diverse knowledges.
HealthWest became a link between cultural diversity and the mainstream. For all of us, health literacy is critical.
I joined HealthWest in 2018 as his project support officer for working with men. We form a community group so that we can work with youth, women and other people so that we can bring peace and harmony in the community.
I was involved with health literacy work that HealthWest was leading. It started all the way back in 2014. Back then, health literacy wasn't as prominent in the sector, in policies and everything that was coming in terms of healthcare.
The ways in which we approach projects with migrant and refugee communities aligned perfectly. So they're on board with the intersectional approach, the collaborative approach, and the fact that they were also aware that we needed to get the best available data and evidence for policy change.
The public health system is very complex, and we need to make sure that the voice of our community is central to that. As someone who works in a hospital, often the focus can be on the clinical aspect and, let's fix the illness. But there's so much more that we need to think about when it comes to people and person-centered care, and the work we have done with HealthWest support continues really to go down that path of looking at the broader person and not just their illness.
Organizations that are delivering services to the community need to have the best possible relationship with that community. To have a thriving country, you need people in the community to remain healthy. The best way to do that is to work on health promotion and in prevention of all kinds of illnesses.
Community participation is a human rights principle. We are obeying principles of the Human Rights Charter. To me, it's no questions asked.
Transformational change, especially at that systems level, doesn't happen overnight. Co-designing with communities is essential because we need to involve those communities who are most impacted by the issues and who will be most impacted by the decisions that we make at a policy level.
Praxis. Let's take the knowledge, let's take theory, let's get really smart people regardless of their pieces of paper, and let's do something in a way that's respectful, where everyone's allowed to contribute fully.
We had a workshop with lots of people, and there were consumers involved, people from the community.
Family violence is a big issue, so it needs to be interpreted, it needs to be broken down with a federal, state and community level. And breaking down to community level, it needs support from partnerships like HealthWest. Not just implementing it, how to implement it in the best way.
For us, it was very important that if we're going to create a set of guidelines around how to do things, that we're using the best available evidence to inform those sort of initiatives. An effective way to do that is to make sure that you create long-term partnerships with that community, but also that you hire people from those communities, that they are well represented.
Trying to do interventions without the community is doing things to the community. We want to do things with the community.
HealthWest was actually bridging that gap so that they can able to provide that services, that expertise, and also to keep the group together and also to able to support us whenever we need it.
You can't stop people when they feel included.
There's a very unique model in what we have with HealthWest, and making sure that whatever we have learned, we share for the benefit of the community.
You can produce a guide, you can produce a tool, a self-assessment, all those things. But when it comes to really make a contribution shows you that the spectrum, from theory to practice in a very systematic and rigorous way. When peers and people in the community are telling you that this works for us, listen.
We now have a model of how to develop culturally adapted information, not just translate from English to other languages, which is so critical.
What ended up being a let's take promising practice of Men of Brimbank and apply it to a different setting, a university campus, actually turned into a model.
Because we had a wide cross-section of people participating in the program, they were able to take that knowledge back to their organizations and be direct advocates of our work, then using the tools.
If we are going to work on the issue of achieving health equity, I think we need to role model our behaviours and our relationships and the ways in which we work together.
You have this loyalty around the work. It becomes what you live and breathe. And this is unique to HealthWest Partnerships because not everywhere can create that kind of atmosphere for its staff as well as the community.
Most of the materials that was developed, most of the resources that was developed are still being used so that I can able to share the knowledge that I gain with my community and the community to come.
We are going to be way more responsive than we are nowadays to all of the different needs that our community has.
I hope that we find a way for this to continue because we do need to think about people holistically and thinking about social determinants of health, which in the West are so critical.
HealthWest is there to actually see that there is a fairness. We can see how it can reduce impact or it can reduce the causes of violence in our community. I see them as a real resource center which need to exist within the health sector. That is what we want. That is what the community wants.
It's not a once and for all. You have new waves of migration, new languages, new cultures. This is work that has to continue and strive. It's leaving a legacy to be taken up and continue, supported and celebrated, which is what we're doing now.
Having then that research which we can share with others and inform the sector and build the capability of the sector was really, something I'm really proud of. And HealthWest was a critical part of that.
HealthWest really sets an example, for the future of public health, for community engagement, for working in the health literacy space, as I haven't seen. When they engage in robust evaluations of processes and interventions, that's a great legacy.